1. Impact of Trump's spending package on rural hospitals. 2. Emergency room crisis, how the big budget bill affects your healthcare. 3. How Trump's $3.4 trillion bill will impact you, Medicaid cuts and tax credits explained. 4. Trump's Medicaid cuts, millions lose health insurance and rural hospitals at risk. 2025 bill. 5. Trump's mega bill, 5 ways millions could lose healthcare access, 2025 policy analysis. 1. Impact of Trump's spending package on rural hospitals. Imagine a future where the very lifelines of rural America, its hospitals, are on the brink of collapse. This isn't science fiction, it's a potential consequence of President Donald Trump's landmark spending package signed into law on July 4, 2025. While this legislation has far-reaching implications for public health, its impact on Medicaid funding is particularly devastating. Over the next decade, Medicaid spending will be slashed by more than $1 trillion, leaving an estimated 11.8 million people without health insurance. And here's the kicker: rural communities, which are already struggling with limited resources, will bear the brunt of these cuts. As researchers deeply invested in understanding rural health and health policy, we can confidently say that these changes will hit rural America harder than most people realize. Why? Because nearly 66 million Americans, about 1 in 5, live in rural areas, and they rely heavily on Medicaid for their healthcare needs. For many, Medicaid isn't just a safety net, it's often the only option available. The ripple effects of this legislation could lead to a surge in unpaid medical care that hospitals must provide, forcing them to make painful decisions like cutting services, laying off staff, or even shutting down entirely. Is this really the future we want for rural healthcare? So, what makes this legislation so damaging to rural health? Let's break it down. First, the bill introduces significant changes to how states fund their share of Medicaid programs. It restricts where funds can come from, limiting the ability of states to tax hospitals, managed care organizations, and other healthcare providers. These limitations will directly reduce payments to rural hospitals that depend on Medicaid reimbursements to stay operational. Without those funds, how will these hospitals continue to serve their communities? But here's where it gets controversial. The bill also mandates work requirements for Medicaid enrollees starting in 2027. Under this rule, most beneficiaries will need to work at least 80 hours per month or be enrolled in school part-time to maintain coverage. Sound reasonable? Maybe not. Take Arkansas's short-lived experiment with similar requirements back in 2018. It didn't boost employment as expected but instead created bureaucratic hurdles that left eligible individuals without access to healthcare. Adding insult to injury, states will now have to verify Medicaid eligibility every 6 months rather than annually, increasing the likelihood that people will lose coverage due to administrative errors or missed deadlines. And this is the part most people miss: these changes won't just affect Medicaid. The bill also modifies premium tax credits under the Affordable Care Act, ACA, making it harder for millions to afford coverage through the ACA marketplace. With shorter enrollment periods, stricter income documentation rules, and the expiration of expanded pandemic-era tax credits, the Congressional Budget Office predicts that around 3 million fewer people will be insured through the ACA by 2034. Factor in another 4.2 million who may lose coverage when the expanded tax credits expire, and you're looking at a healthcare crisis waiting to happen. To soften the blow, lawmakers allocated $50 billion over 5 years for a newly created Rural Health Transformation Program. Sounds promising, right? But here's the catch: estimates suggest that rural areas stand to lose $155 billion in federal spending over the next decade. That means $50 billion is merely a band-aid on a much deeper wound. How effective will this program really be if the underlying issues aren't addressed? The reality is, rural and frontier hospitals were already teetering on the edge before this legislation came along. Aging infrastructure, sicker patient populations, geographic isolation, and financial challenges have been driving hospital closures for years. Since 2010, 153 rural hospitals have shut their doors permanently or stopped offering inpatient services. Now, with these new cuts, hundreds more are at risk of scaling back essential services, converting to alternative models, or closing altogether. Maternity care, in particular, is hanging by a thread. More than half of rural hospitals no longer deliver babies, and further cuts to Medicaid could accelerate this trend, leaving expectant mothers with no choice but to travel long distances or give birth outside traditional settings. It's not just about healthcare, though. Rural hospitals are economic engines, providing some of the highest-paying jobs in their communities. When a hospital closes, it doesn't just mean less access to medical care, it means fewer jobs, a shrinking tax base, and dwindling funds for critical services like roads and schools. And let's not forget, rural America feeds, fuels, and powers the nation. If we allow our rural healthcare systems to crumble, what does that mean for the broader U.S. economy? This raises an important question. Are we willing to sacrifice the health and vitality of rural America for short-term budget savings? Or should we be rethinking how we allocate resources to ensure equitable access to healthcare for all? We'd love to hear your thoughts. Do you think this legislation strikes the right balance, or does it go too far? Share your opinions in the comments below. 2. Emergency room crisis: how the big budget bill affects your healthcare. Imagine a summer evening filled with laughter, the smell of barbecue in the air, and the magical glow of fireflies. It's a scene many of us cherish. But what happens when life takes an unexpected turn? Your child stumbles, injuring their leg badly. Or perhaps your elderly parent suddenly feels chest pain during what was supposed to be a joyful gathering. In moments like these, we rely on one thing: the emergency room. We trust that it will be open, fully staffed, and ready to help, no matter what. This unwavering confidence in our healthcare system is something most Americans take for granted. Yet, behind the scenes, a major shift is underway, one that could shatter this promise. Buried deep within the One Big Beautiful Bill Act, lawmakers have quietly approved a reduction in the provider tax from 6% to 3.5%. At first glance, this may seem like just another mundane policy tweak. But here's where it gets controversial. This seemingly small change has the potential to upend the entire healthcare system, leaving families across the country unprepared for the ripple effects. To understand why, let's break it down. Think of the healthcare system as a complex web, where every piece depends on the others to function properly. Emergency rooms, hospitals, and nursing homes are interconnected, much like gears in a machine. The Provider Tax acts as a crucial cog in this system. Used by 47 states, it funds Medicaid, a lifeline for millions of low-income families, children, and seniors who depend on affordable healthcare. Hospitals contribute to this tax, and in return, states leverage it to secure federal Medicaid dollars. These combined resources ensure that ERs remain operational, hospital beds stay available, and nursing homes continue caring for vulnerable populations. Most people aren't even aware of the provider tax's existence, yet it plays a vital role in keeping the healthcare system afloat. Without it, hospitals might struggle to provide care regardless of whether patients have private insurance or none at all. Now, imagine the impact of cutting this funding nearly in half. It's not just a budget adjustment, it's more like dropping a wrecking ball into the middle of a delicate structure. According to a recent analysis by researchers at Brown University's School of Public Health, this legislation could lead to the closure of over 600 nursing homes nationwide. That's 600 facilities caring for grandparents, stroke survivors, and adults with disabilities. When those doors close, the repercussions will be felt far beyond the walls of those nursing homes. Here's how it might play out in real life. You rush your injured child to the ER, only to find chaos waiting for you. The waiting room is overcrowded, gurneys line the hallways, and medical staff look overwhelmed. Babies cry, elderly patients groan in discomfort, and despite everyone's best efforts, there simply isn't enough space or staff to handle the influx of patients. Why? Because hospital beds are occupied by individuals who should be receiving follow-up care in nursing homes, but those facilities are now shuttered due to funding cuts. And this is the part most people miss: the domino effect doesn't stop there. Studies show that overcrowded ERs don't just mean longer wait times, they also increase the likelihood of missed diagnoses and raise the risk of death for conditions requiring immediate attention, such as heart attacks, strokes, or sepsis. For rural communities, where access to healthcare is already limited, the consequences could be catastrophic. If nearby nursing homes or hospitals close, the nearest ER might be an hour away, and in emergencies, every second counts. While low-income households and those relying on Medicaid will bear the brunt of these changes, no one will escape unscathed. Even if you're fortunate enough to have private insurance, crowded ERs mean slower service for everyone. CEOs and cashiers alike will face the same delays. What makes this situation particularly troubling is the lack of viable solutions left for states. Lawmakers who supported this bill argue that states can pick up the slack by implementing new taxes or increasing existing fees. However, this approach would create uneven standards across the country, with some states struggling to maintain adequate healthcare infrastructure while others thrive. Is it fair to leave such critical services to chance? At its core, this issue goes beyond politics, it's deeply personal. Nursing homes are more than institutions. They're places where loved ones receive care and recover. And ERs are more than buildings. They represent hope and safety during life's scariest moments. If hundreds of nursing homes close in the coming years, the promise of a reliable ER becomes harder to fulfill. As you enjoy the warmth of summer with your family, take a moment to reflect on what truly brings you peace of mind. Sure, vacations and barbecues are wonderful, but isn't it the knowledge that help is always available in an emergency that allows us to relax? For now, that assurance remains intact in most parts of the U.S. But if this policy unfolds as predicted, future summers may feel very different. Will you still feel safe knowing that the next time an accident happens, the ER might not be ready? What do you think needs to be done to protect our healthcare system? Share your thoughts below. 3. How Trump's $3.4 trillion bill will impact you. Medicaid cuts and tax credits explained. Imagine a sweeping change that could reshape the financial landscape for millions of Americans. President Donald Trump has successfully pushed through a monumental $3.4 trillion legislative package, often referred to as his big, beautiful bill. This extensive legislation introduces a variety of tax breaks, spending cuts, and increased funding for defense and immigration enforcement. However, it also raises concerns among fiscal conservatives about the potential addition of $4 trillion to the national debt over the next decade. This bill is poised to impact nearly every American, regardless of their age or income bracket. Let's break down the key components. Taxes *. One of the most significant tax benefits in this legislation is a new deduction for middle-income seniors. Individuals aged 65 and older can now claim a deduction of $6,000, or $12,000 for couples, if their income is up to $75,000 per year, or $150,000 for couples. However, this deduction gradually decreases for higher earners and is completely phased out for singles earning over $175,000 and couples over $250,000. Healthcare *. While Medicare is a crucial program for many seniors, it does not cover long-term care, leading many older adults to rely on Medicaid. This government program, which supports over 60% of nursing home residents, faces significant cuts under the new legislation. These reductions could force some nursing homes to close or limit their services, making it increasingly difficult for seniors to secure necessary care. Child benefits *. The bill introduces several new and improved benefits for families with children. The child tax credit has been raised to $2,200 per child, with annual adjustments for inflation. However, a notable change is that non-citizens are now prohibited from claiming this credit, even if their children are U.S. citizens. Additionally, families with incomes too low to qualify for the full credit, approximately 1 in 4 children, will see no changes to their situation. For children born between 2025 and 2028, the legislation establishes a tax-deferred investment account, starting with a $1,000 government contribution. Parents, employers, and nonprofits can also add to these accounts. Furthermore, the tax credit for adopting a child has increased to $5,000, with provisions for inflation, and there are expanded programs for businesses that offer parental leave and workplace daycare. Tax cuts *. Without this new legislation, temporary tax cuts from Trump's first term would have expired at the end of the year, resulting in higher taxes for many households. Instead, the standard deduction will rise to $15,750 for individuals and $31,500 for married couples, while maintaining the lower tax rates established in 2017. Benefit reductions *. The bill also proposes significant cuts to health care programs like Medicaid and anti-hunger initiatives such as the Supplemental Nutrition Assistance Program, SNAP. Medicaid recipients may lose their coverage if they fail to meet new work requirements or do not provide documentation proving they are working, volunteering, or attending school for at least 80 hours a month. Even those exempt from these requirements could lose their health insurance if they do not submit the necessary paperwork. When considering the overall impact, low-income households may find themselves at a disadvantage, losing more in benefits than they gain from tax breaks. For example, a single parent earning $20,000 annually might save around $750 in taxes but could lose over $1,600 in benefits. Tax breaks for non-assistance families *. Families not receiving government assistance, such as food stamps, will primarily benefit from the tax cuts in this bill. This includes provisions that exempt certain overtime pay from taxation. Additionally, the cap on deducting state and local taxes from federal taxable income has been raised from $10,000 to $40,000 for households earning below $500,000, which is particularly advantageous for families in high-tax states. However, it's important to note that the SALT cap has historically impacted wealthier individuals more significantly. Middle-income families, particularly those earning between $53,300 and $92,100, can expect an average tax cut of $1,510, according to the Institute on Taxation and Economic Policy, ITEP. Disproportionate benefits for the wealthy *. The most substantial tax cuts will benefit the wealthiest Americans. While low-income families may see minimal changes, high-income households will enjoy significantly reduced tax liabilities. ITEP's analysis indicates that 72% of the total value of tax cuts will go to the top 20% of earners, with over 20% directed to the top 1%. Health care coverage losses *. The bill proposes a staggering $1 trillion cut to Medicaid, marking the largest reduction in the program's history. This could result in at least 17 million Americans losing their health coverage or the subsidies that make insurance affordable, as projected by the nonpartisan Congressional Budget Office. New work requirements *. For the first time, work and reporting requirements will be imposed on Medicaid recipients earning between 100% and 138% of the federal poverty level, approximately $32,000 to $44,000 for a family of 4. Individuals aged 19 to 64 will need to demonstrate that they are working, volunteering, or studying for at least 80 hours a month. Exemptions are available for certain groups, including pregnant individuals, those with disabilities, or caregivers of children under 13. States must implement these requirements by December 31, 2026. Increased documentation burden *. Medicaid recipients will now be required to submit documentation, such as pay stubs, to prove compliance with the work requirements. Even those who qualify for exemptions must demonstrate their eligibility. Healthcare providers have expressed concerns that these new requirements could lead to many individuals losing their coverage due to the complexities of maintaining proper documentation. Starting in 2027, states will also need to conduct additional eligibility checks every 6 months, which could result in individuals losing coverage unexpectedly during the year. Tax-free tips * In line with Trump's campaign promise, the bill allows workers earning up to $150,000, or $300,000 for couples, to exclude up to $25,000 of tip income from taxation. However, to prevent abuse, the Treasury Department will compile a list of professions that typically receive tips, and only those workers will be eligible for this deduction. Child tax credit restrictions ** filers without Social Security numbers, typically non-citizens, will no longer be able to claim the child tax credit, even if their children are U.S. citizens. They will also be ineligible for tax code changes that affect tips, overtime pay, and certain education credits. Changes to education loans ** The legislation also repeals student loan forgiveness programs established during the Biden administration. It introduces new repayment standards for borrowers, requiring fixed payments over 10 to 25 years based on their loan terms. Under the new means-tested plan, payments will range from 1% to 10% of the principal, with borrowers able to deduct $50 per payment for each dependent. Timely payments will be rewarded, with unpaid interest waived and the government matching $50 per payment on the loan principal. Any remaining balance will be forgiven after 30 years. In summary, while this legislation promises tax cuts and benefits for many, it also raises significant concerns about the potential loss of essential services and support for the most vulnerable populations. What are your thoughts on these changes? Do you believe the benefits outweigh the drawbacks, or do you think this bill will disproportionately harm low-income families? Share your opinions in the comments. 4. Trump's Medicaid cuts, millions lose health insurance and rural hospitals at risk? 2025 bill. Millions to lose healthcare coverage due to Trump's Medicaid cuts in tax and spending bill. President Donald Trump's domestic policy bill, signed into law on July 4, 2025, brings about significant changes to the U.S. healthcare system. The legislation aims to cut approximately $1.1 trillion in healthcare spending, which, according to the nonpartisan Congressional Budget Office, will result in 11.8 million people losing their health insurance over the next decade. This is a substantial blow to the 72 million people currently enrolled in Medicaid, representing around 1/5 of the U.S.'s total population. U.S. Representative Mike Levin expressed his concerns, stating, regardless of the type of insurance you have, whether it's Medi-Cal, Medicare, the Affordable Care Act, or employer-provided or private insurance, the healthcare situation in the United States has been significantly worsened by this bill. The Trump administration defends the cuts, claiming they are necessary to eliminate waste, fraud, and abuse. However, the impact of these cuts on people across the country, including those in San Diego, has raised concerns. Vanessa Norman, a San Diego therapist, voiced her worries, saying, "I can't believe it. I'm so worried about our kids." The changes to Medicaid and other programs will be gradually implemented in the coming years. But here's where it gets controversial. While the administration insists the cuts are necessary, critics argue that they will leave millions uninsured and threaten the stability of rural hospitals. And this is the part most people miss: the potential long-term consequences of these cuts on the overall health and well-being of the affected population. What are your thoughts on this issue? Do you think the cuts are justified, or do they pose a significant threat to the healthcare system? Share your opinions in the comments below. 5. Trump's megabill, 5 ways millions could lose healthcare access, 2025 policy analysis. 5 ways President Donald Trump's proposed tax and spending bill will restrict access to healthcare. 1. Medicaid enrollment restrictions ***. A significant reduction in federal support for Medicaid will force millions of enrollees to prove they meet employment, volunteer, or attend school requirements. These changes apply to 40 states and Washington, D.C., including some in Republican-leaning regions. Studies show these rules may lead to fewer people with disabilities accessing care. 2. Provider tax impact ***. The bill curtails a practice used by many states to increase Medicaid payments to hospitals and providers, which often results in higher costs. This shift could push rural hospitals toward reduced services or closures, as seen in research showing up to 300 rural hospitals might face service cuts. 3. ACA coverage challenges ***. The legislation requires updated information for ACA policyholders each year, unlike the 10 million who automatically enrolled. This change could leave older adults or those with chronic illnesses struggling to access coverage, as noted by researchers from the Cecil G. Sheps Center. 4. Higher out-of-pocket costs states that expanded Medicaid must charge enrollees up to $35 for certain services when their income is within a poverty level. While this policy aims to reduce costs, it may discourage necessary care due to studies showing small copayments can lead to neglect. Some states have already implemented similar charges. 5. Immigrant subsidy losses Trump's plan could prevent hundreds of thousands of lawfully present immigrants from receiving subsidized ACA plans, including asylum seekers and refugees. This decision would disproportionately affect older, sick, and economically disadvantaged individuals, further increasing premiums. These changes reflect a controversial approach to healthcare reform, raising questions about accessibility and equity.